All right, so this is the part where I discuss the future directions of the disease. I did look into a couple, well, not a couple, but in about two unanswered questions. So the first one was, does schistosomiasis occur in organs other than bladder, bowel, and liver? Occurrence in the bladder, bowel, or liver are the most common. So I wanted to look a little bit more into other cases. And I did find that other areas would be in the genital areas. So then once I found that, then I wanted to see, okay, well, between female genital schistosomiasis and male genital schistosomiasis, which is more common? And I did find that the clinical signs and complications are much more prevalent in female genital schistosomiasis, and it is definitely more common in females. All right, so female genital schistosomiasis. So this cause, if we remember, if looking back at the life cycle that I had in the other slides, I discussed that the second pathway of eggs is to get trapped in the organs. So this is when they travel down to the genital tract and then those areas. So it's caused when eggs cause damage to the reproductive organs. Some signs, mostly in the genital tissue, is going to be abnormal vessels, sandy patches, and rubbery papules. Some symptoms include unusual vaginal discharge, which is usually blood or just a really strong smell, blood and urine, abdominal and pelvic pain. And then these complications can cause infertility, miscarriages, or ectopic pregnancy. And the reason that I found that FGS occurs in up to 70 women that are infected by schistosomiasis. So that's already more than half of any woman who ever gets this disease. They're at a high risk chance to get female genital schistosomiasis. So this is why it is, I found that it was more common in females than in males, but also I wanted to just discuss the ectopic pregnancy really quick. So this is when it's a pregnancy outside of the uterus, and this would have to do with the eggs just being in the way and then causing damage to what your reproductive organs are meant to do. So those are the complications. And female genital schistosomiasis is also more common because it's far more unreported, usually unreported because due to embarrassment, they don't want to report it. It's also misdiagnosed because people, it can be mistaken as any STD or STI, and it's largely untreated. Same thing. If they're treated for a sexually transmitted disease, it's definitely not going to treat this as well because this is completely different. And then in addition to these physical symptoms and these physical complications, I think the most important thing, I think it's really important that it's causing mental health problems in women because there's a stigma of STDs and STIs, and they're completely getting misdiagnosed, and it's just something that really causes women not to report it or to get misdiagnosed. So also right here it says, and due to social exclusion due to infertility. So these complications cause a lot of problems in women, and this causes problems in the marriages and causes depression in the women. All right, so here is the biology of female genital schistosomiasis. So once they're in your system, pierce the skin, they go to the lungs and the liver, and then they start to just migrate down to the organs, and then they get trapped in these organs. So the worm pairs are going to, instead of just staying where we talked about, where they stay in the bowel or the liver, these worm pairs are going to go ahead and travel down the pelvic venous plexus, and then they're going to go ahead and release and lay these eggs in all these areas here. You see all these areas where the eggs are, and then from the eggs, there comes the parasites, and there come all these troubles. And in males, so here's a comparison of female genital schistosomiasis and then male genital schistosomiasis. So it's basically the same thing. This one doesn't really show, but the worms are living up here, and then they release their eggs on these areas. And here is one of the most common names that we discussed earlier. And then these eggs are trapped in the genital tracts, and they can also be found in genital tissue. So these eggs just travel everywhere in the body. Of what researchers and lots of regions are trying to do right now to try to solve this problem. There's this website, and it's called the Schistosomiasis Control Initiative. They've been working for 2 years, and they're trying to improve health in these areas. And one of the things that I saw that they discussed is this disease is usually correlated to areas of high poverty, but they're also kept at poverty because they're not able, when they have these infections, they're not able to go on with their lives and work and do everything as they normally do. So it's kind of just a little cycle of just staying in this disease, keeping them in poverty because they cannot progress their normal life. So what this foundation is trying to do is they are trying to provide better training to the healthcare professionals, so they know better to diagnose this disease, and then they can treat it better, and then provide more support to these women so that they don't feel so alone. Another way that they're trying to do is to increase awareness about the disease, just educating people so that they're not pulled into the stigma of STDs and STIs. I've also included the website here where you can go ahead and look at all the work that they're doing, all the what the foundation is researching, and to donate to help with their research. I did find this cross-sectional case study, and it's investigating the relationship between HIV and female genital schistosomiasis. So because of the stigma of STDs and STIs, I thought this would be a really good case study. For FGS. And basically, the study investigated the relationship between HIV and FGS. They investigated the most common snail species that it came from, and they pulled a lot of studies from PubMed and Medline, and they had a lot of requirements in order for these studies to be chosen. So these studies had to include women with FGS, and they also had to include the detection of schistosomiasis DNA, or also detection of eggs, or detection of these eggs in the genital tissue. The studies also had to include a comparative group for both HIV and FGS. And out of all the studies that were reviewed, only 2 of them fit the criteria, and both of these studies were in African population. From these 2 studies, they extracted study locations, the study design, the participants' age, and the way that the authors defined female genital schistosomiasis. So from there, they concluded that female genital schistosomiasis is definitely a neglected disease affecting women in sub-Saharan Africa. And female genital schistosomiasis is a risk factor that compounds biological and cultural polarities. And they found that they did not find one sole mechanism that can link female genital schistosomiasis and HIV, but they did find that there is definitely more. Once you have female genital schistosomiasis, there's definitely a higher risk to get HIV transmitted. So they're still looking, but they did not find any complete evidence that found any mechanism linking both of these. But this definitely ties back into the misdiagnosis and stigmatism of female genital schistosomiasis and any sexual transmitted disease. These patients are at risk for HIV, and I think it's important that there's definitely a separation between the two. And then this can help with the misdiagnosis and mistreatment of female genital schistosomiasis.